Hey everyone, I'm Dr. Victoria Reinhartz and this is the Reinhartz Rundown. Wanted to do a quick video today on the history of digoxin, where it came from, and give you a fun fact or two. First things first, what is digoxin? Digoxin is categorized as a cardiac glycoside and has really been around for a long time. Dig actually comes from the foxglove plant, Digitalis purpurea, and it was discovered way back in the 1700s. Now, back then it was used for patients with swelling, with irregular or weak pulses. Anyone in medicine now recognizes that those symptoms can be secondary to heart failure, arrhythmias, or other cardiac conditions, and this is likely why it was helpful in symptom management. Today, we know a few more things about it. That's because it's indicated for heart failure, AFib, and cardiac conditions, and has really been widely used over the last several decades. It has a very narrow therapeutic index, meaning it's effective and helpful while the blood levels of the drug are in this very small window. But that once we go a bit outside that narrow therapeutic range, we see toxicities, events, and therapeutic failure. Number 3, the side effect profile is unique. Let's talk a little bit more about that side effect profile. With digoxin, we see nausea and vomiting as one of the very first signs of toxicity, along with loss of appetite and abdominal pain possibly. Remember too that digoxin lowers heart rate, so patients with toxicity may have bradycardia or a heart rate less than 60 beats per minute. In severe cases, the patient may actually have prolonged PR interval, arrhythmia, shortness of breath or fainting, headache, and confusion or delirium. Another thing we see is especially unique, and this is changes in vision, specifically yellow-green vision, blurriness, and halos that are appearing around lights and objects. As a fun fact for the day, Vincent Van Gogh, the infamous painter of Starry Night or that Night Cafe painting, was known to have multiple health conditions, cardiac conditions, and it's actually now thought that Van Gogh's characteristic style of halos and intense yellow period that he went through with shimmering yellow tones might have been digitalis toxicity. Well, that or all the absinthe he drank. Hope you enjoyed today's video, and we'll see you next time for the Reinhartz Rundown.